You recall from earlier discussions that in the first phase of work comp care, we make an AOE-CU decision rising out of and in the course of employment. And what that means is there always needs to be a causal and a temporal relationship to the job, to the workplace. And so there needs to be something that actually happened on the job and in a reasonable period of time. Both of those factors need to be present for something to be considered job related. So here's a situation I saw in May of 2021. Patient worked for about 5 months at a local ag packing plant and sanitation. He walked into an area where several coworkers were active, felt a sense of panic with dizziness for whatever reason, slightly blurred vision, and then became unconscious, fell to the ground and hit his head, and was then unconscious for a period of time. Unconscious for an unknown period of time, perhaps 30 minutes, according to the patient, I guess based upon what people told him. An ambulance was called. During transit to a local emergency department, he became conscious, had no antecedent chest pain, shortness of breath, palpitations, or any other symptoms prior to the event. Evaluation in the emergency department included skull films and a physical exam. There was no serious head injury that was evident. He was recommended to temporary total disability for 2 days and then returned to regular work and cleared to do his regular activities. Interesting, and this is helpful in this case, particularly, patient reported he had had similar episodes with dizziness, but not syncope, approximately twice yearly for the past 10 years, never had a medical evaluation. On follow-up in June, the next month, the patient felt well. He had no further episodes of dizziness. He was able to do all of his usual and customary work in sanitation. So is this job related, or what parts of what happened are job related? There were two aspects of this. One is, of course, the fact that he had a syncopal episode, and the other is that he hit his head, had a head injury. His 30 minutes of unconsciousness was not known whether it was part of the syncopal episode or part of the head trauma, that he had a concussion. And so how do you decide that? Has anybody run into this before, had this particular question arise in the course of your work comp activities? It's not real common, but here's the way that this ends up getting managed in the work comp world. So what we need to do is distinguish between events that occur on the job that are related to work, and those that are incidental to activity in the workplace that happen to occur there. And those that are not, that there's not a causal relationship, maybe there's clearly a temporal relationship, something happened on the job, but there's not a causal relationship. That is to say that the job didn't cause, or activity related to work specifically did not cause the problem to occur. And so in this case described, there was a temporal relationship happened on the job, but it wasn't clear that the syncope was, there was a causal relationship. So the way carriers tend to manage these is they will pick up the complication or the secondary event of whatever happened on the job that was non-industrial. Now, if something had caused him to pass out on the job, whatever it might have been, then both the syncopal episode and the head trauma would be considered job related. In this particular case, the carrier chose to, as was typical, consider the syncopal episode non-job related. There was no relationship to what happened in the course of the workplace, but they did pick up the head injury. And so the significance of this is, and was the case with this patient, do you let him go back to, what do you do about that syncopal episode? If he were somebody that tended to work in construction, for example, or in the packing shed and was on ladders and fell, rather than falling from floor level, fell from a height and was unconscious, fell and had a serious injury, that would clearly be a big problem, a bigger problem. And so part of the evaluation here was clearing the patient from having some sort of cardiac or neurologic problem that really needed to be identified. So he was sent to a cardiologist on a non-industrial basis, evaluated, didn't find anything treatable, but was recognized as a non-industrial event. And the head injury resolved as described, no sequelae, and was fine. So he eventually went back to work following the non-industrial evaluation, cardiac evaluation of his syncopal episode, and was deemed to have no adverse sequelae from the head injury. So resumed work at a month or so later, and this was fine. So AOE, COE arising out of it in the course of employment, the causal relationship, we really need to establish the causal relationship between the workplace, the job being done, or an event in the workplace that's part of the work, as well as the temporal relationship. Now, there are other types of situations where this can occur that are, a little more clear, where there isn't a secondary problem, but patient that develops appendicitis while working on the job. Clearly, hard to imagine there's a job-related cause there. A CVA or TIA, the CVA, it's either embolic or thrombotic or hypertensive. There may be some circumstances where you could consider a CVA, a hemorrhagic CVA, job-related, if you could make the case for hypertensive event on the job. But in most cases, that's a stretch, and these would be considered non-industrial events. And if somebody had a CVA and became unconscious, fell, then it would be managed the same way as the case just described. Seizures, the same way. What was a little bit helpful also in the case of this patient we just described was that he had been having, over the 10-year period previously, at least dizzy episodes, although not syncopal. So there was some non-industrial history to that too, but in these cases, oftentimes there's no non-industrial history that's useful. So AOE, COE, causal relationship, temporal relationship.